President, it is very hard for me to understand how anyone could be voting to repeal the entire health care bill, because when you do that, among other things, what you are saying is that we will continue the odious practice of denying health care by insurance companies to people who have pre-existing conditions. Now, for 8 years under President Bush, more and more people lost their health insurance. The cost of health care soared, and our Republican friends had virtually nothing to say on health care. Now that a bill has been passed, which I am the first to agree is not the best bill that we could have passed, and I will tell you why. It has its share of problems which should be remedied. But to say right now, when 50 million Americans have no health insurance, when states all over this country are wrestling with huge budget deficits, which no doubt will result in millions more being thrown off of health insurance, to say we should retreat to where we were is beyond comprehension. Second of all, for my Republican friends to say let's repeal health care, there are millions of families that now are beginning to be able to include within their own health care plans their sons and daughters up to the age of 26. Buy to that. Furthermore, in a nation which ends up spending more on health care, almost double per person compared to any other nation on earth, we have put in the health care reform bill billions of dollars for disease prevention. We are, as a nation, very weak in terms of trying to keep people healthy, trying to keep them out of the hospital. We spend a fortune on people after they're sick. In this bill, we have made some significant steps forward in terms of disease prevention, wellness, which is very, very cost-effective in terms of health care dollars, not to mention human pain and suffering. In that regard, I'm proud to have worked with a number of other senators in doubling, in that bill, the number of community health centers in America, which was providing the most cost-effective primary health care that is provided in this country, keeping people out of emergency rooms, keeping people out of hospitals, giving them access to primary health care, dental care, low-cost prescription drugs, and mental health counseling. In the midst of an extraordinary crisis in terms of primary health care, where everybody recognizes we don't have enough primary health care doctors or nurses or technicians, we tripled funding for the National Health Service Corps, and it is already working effectively in getting doctors and dentists and nurses and other practitioners into underserved areas. All of that would be undone, and I think that makes no sense whatsoever. Now, to my mind, what we have to do is not to repeal this bill, but to make it a better bill. And I will give you one very specific suggestion that I have worked on now for over a year. Senator Wyden has worked on this. Others have worked on that. And that is to say that if a state in this country, the state of Vermont, the state of Alaska, any other state, can maintain the high standards for quality health care and coverage that the National Health Care Bill did, then that state should be given significant flexibility to perhaps do it in their own way and do it more cost-effectively. And I should tell you, Mr. President, that in the state of Vermont, our new governor is a supporter of a Medicare for All single-payer program. There are other states that want to move in a different direction, maintaining high standards, but doing it perhaps in a different way that has been proposed by the national legislation. In my view, they should have that right. And if Vermont is effective in doing what I believe we could, providing quality health care to all of our people in a cost-effective way, I suspect other states around the country can learn from Vermont's experience. I think that is a positive step forward. The beauty of our federalist system, 50 states, every state has a good idea. And I think that if we maintain standards that are high and give states flexibility, this can improve the health care reform bill that we passed last year. But killing this whole bill makes no sense to me at all.